Everyone, today our topic is the level of prevention. We all know that prevention is better than cure. So let's start today's topic. It is one of the most important topic for all nursing entrance exam. So let's briefly summarize about the theoretical portion of topic, then quickly move to the question. What is a prevention? Prevention is the action which help to eradicating or eliminating or minimizing the impact of disease and disabilities. So there are mainly four types of prevention: primordial, primary, secondary and tertiary. So let's see one by one. First one is primordial. So in primordial prevention, prevent the development of risk factor. So in a primordial, there is an absence of risk factor and we have to prevent the development of risk factor. Okay. Then second one is a primary level of prevention. In that, minimize the risk factor. So in primary prevention, there is a presence of risk factor. So we have to minimize that risk factor. In both primordial and primary level of prevention, there is an absence of disease. Okay, but we take a action to prevent the risk factor and to prevent the further disease. Okay, then next one is a secondary level of prevention. So here patient is if undiagnosed or asymptomatic, so it include the early diagnosis, treatment and screening. So here patient either have a symptoms or patient have a undiagnosis. Then third one is a tertiary. So in tertiary, patient have a disease courses. In that we have main aim is to minimize the complication of a patient. So here there are mainly four levels of prevention. In primordial, there is an absence of risk factor. In a primary, there is a presence of risk factor. In a secondary, patient is either asymptomatic or undiagnosis. And the fourth one is a patient have a disease and we have to minimize the complication of that disease. Okay, so this is a basic summary of a level of prevention. So now let's move to the question session. Our first question: using of a contraceptive include in which level of prevention? Okay, so using of a contraceptive. Okay, so we use the contraceptive to prevent the pregnancy. So here presence of a risk factor is okay, so it include in a primary prevention. So here our answer is a primary level of prevention, because in the primary level of prevention we learn there is a presence of a risk factor. Okay, the next: give BCG vaccine at a time of birth comes under which level of prevention? So primary prevention include specific protection. Okay, so immunization is one kind of specific protection against the disease. So it include in a primary level of prevention. So any immunization which include in a primary level of prevention. The third question: establishing a school for a blind child comes under which level of prevention? So here we minimize the complication, we restore the life of patient who actually have an impairment. So here it include in a tertiary level of prevention. Our right answer is a tertiary level, because in a tertiary level patient have a disease condition and our aim is to restoring the patient life. So here our right answer is a tertiary level of prevention. The next question: give a iron folic acid tablets to pregnant mother include in which level of prevention? So here we use the aim of a specific protection against neural tube defect. Okay, so it include in a primary level of prevention. So give iron folic acid or any chemoprophylaxis drugs, it include in a primary level of prevention. The next question: monthly breast self examination include in which level of prevention? So here our right answer is a secondary level of prevention, because we learn that the secondary level include the early diagnosis, treatment and a screening. So any screening method like breast self examination, so pap smear for a cervical cancer. Okay, so any screening method is included in a secondary level of prevention. The next question: Mr. Ashok Kumar is wearing a seat belt while driving. He used which level of prevention? So here our right answer is a primary level of prevention. So it include in a specific protection because we protect against the accident cases. Okay, so wearing of a seat belt, then wearing of a helmet, these all are including in a primary level of prevention. The next question, a community health worker give tablet of albendazole to all children below 5 years is come under which level of prevention? So here we minimize the risk factor. Okay, so it comes under the primary level of prevention. Then next question, a nursing officer use PPE while dealing with an immunocompromised patient. Here which kind of prevention is used? Here our right answer is a primary level of prevention is used by a nursing officer. Okay. Next question, ban the alcohol or prevent the selling at a certain time, it include in which level of prevention? So here our right answer is a primordial level of prevention. Okay, bending of alcohol is included in a primordial level of prevention. So most of students have a doubt about primordial level of prevention and a primary level of prevention. So let me clear it. Primordial prevention emphasizes a broad sphere of influence compared to a primary prevention, which target the individual response to a risk factor. So in a primordial prevention, our target is for a large group like for a country, and in a primary level of prevention, our target group is a individual response to a risk factor. Okay. For example, preventing the sale of alcohol at a certain time, it comes under the primordial prevention, and carrying out the public health campaign about the drinking would come under the primary level of prevention. So here your doubt is clear about the primordial level of prevention and primary level of prevention. Okay, the next question. Many students have a doubt about the isolation and quarantine. So let me clear it. Isolation means a separation of a sick people with a contagious disease from a people who are not sick. So here we protect the healthy person to being infectious. It called specific protection. So it comes under the primary prevention. So please clear your concept regarding isolation, that isolation is not included in a secondary prevention, but it include in a primary prevention, because isolation is used as a specific protection to protect the healthy person to being infectious. So isolation is come under the primary level of prevention. And on the other side, quarantine is a separate and restrict the movement of a people who were exposed to a contagious disease. So here if they are become sick, so it comes under the early screening. So it comes under the secondary level of prevention. In quarantine, we separate those people who exposed to a contagious disease. Here we use to separate the exposed person, and we use to early screening if the patient is sick or not. So it comes under the secondary level of prevention. So let's conclude it. Isolation include in a primary level of prevention because it include in a specific protection, and the quarantine is include in a secondary level of prevention because here we use the early screening of a person who exposed to a certain contagious disease. Okay. Then next question, defluorization of a water comes under which level of prevention? So here our right answer is a primary level of prevention because we minimize the risk factor. The last question, this question is for you. So monitoring of a blood pressure comes under which level of prevention? So please put your answer on a comment box, and if you have a further query regarding level of prevention, then feel free to ask me. Let's conclude this. The primordial prevention include the mass education, in that we used to target a large population like country. Okay, in primary prevention we used to target and we minimize the individual response to risk factor. So as an example, like health education, prevention of occupational hazard, then environmental sanitation, water sanitation, then specific protection like immunization, use of helmet, seat belt, use of contraceptive method, it all come under the primary prevention. Then in the secondary prevention, early diagnosis, treatment, screening, so these all include in a secondary prevention. As an example, like pap smear for a cervical cancer, breast self-examination for a breast cancer, then case finding for a various disease. It includes the all national health control program like a national malaria control program. Okay, so this all program also include in a secondary level of prevention. Contact the tracing of a sexual transmitted infection patient, so it also include in a secondary level of prevention. Then a tertiary level of prevention, so we have to minimize the complication and restore the patient healthy life. So here school for a blind patient, then prosthesis, using of prosthesis, then any rehabilitation therapy like vocational therapy, speech therapy, it include in a tertiary level of prevention. So I hope that your all doubt regarding level of preventions are solved.